Let's turn now to former President Trump. It's been a week of legal highs and lows for the former president, from a victory in the special master case to a recent development in a case against Hillary Clinton.
On Friday, a federal judge dismissed Trump's case against Hillary Clinton and others. Judge Donald Middlebrooks said in a 65-page decision that the claims presented in the amended complaint are not warranted under existing law. Also on Friday, the Trump legal team and the Justice Department are expected to submit their lists of special master candidates. Monday, Trump-appointed Judge Eileen Cannon granted Trump's request for a special master to review documents seized in the Mar-a-Lago raid. But on Thursday, the Justice Department put Cannon on notice that it plans to appeal that decision. Meanwhile, former Trump aide Steve Bannon said on the Charlie Kirk show that the FBI yesterday raided at least 35 Trump allies' homes. Arlene Richards, NTD News, New York.
A report could be coming on the leak of the Supreme Court's draft opinion on Roe v. Wade. Justice Neil Gorsuch says the High Court has been investigating the leak. The justice said, quote, the Chief Justice appointed an internal committee to oversee the investigation. That committee has been busy and we're looking forward to their report. I hope soon, end quote. But it's unclear if the report will be made public. The Supreme Court's draft opinion on overturning Roe v. Wade was leaked to Politico in May, and the court officially published its ruling in June. Gorsuch condemned the leak. He suggested that it may have been intended to influence the outcome of the ruling. Is the government using American tax dollars to buy products made with forced labor in China? That's what lawmakers on the House Oversight Committee want to know, and they're calling for an investigation to get answers. NTD's Melina Weiskup reports.
18 lawmakers on the House Oversight Committee are asking the Department of Homeland Security's Inspector General to launch an immediate investigation into whether tax dollars are being used to buy solar panels made in China, describing the country as an adversary with a record of human rights abuses and slave labor.
80% of the polysilicon capacity, 80% of the solar panel manufacturing capacity, that's all in China.
Specifically, the lawmakers are raising concerns about the U.S. Virgin Islands. The territory is transitioning to solar power, and its governor has plans to make St. Croix 100% powered by solar energy. The DHS awarded the islands $4.4 million in 2021 for a new 28-megawatt solar microgrid project on St. Croix. Now, this criticism from House Republicans comes just months after the Biden administration waived tariffs on Southeast Asian countries as a way to import more solar panel parts because the administration said we had an inadequate supply of solar cells and modules. Now, this is important because the Commerce Department has been investigating whether China is using those very Southeast Asian countries like Vietnam, Thailand, Malaysia, and Cambodia, in order to set up shop there and get around existing U.S. tariffs. In practical terms, here's exactly what that means.
China will, mostly assemble a solar panel, send it to another country, maybe Malaysia, to have a few screws tightened, and then send it off to the United States. There's a big, internal tension between the Biden administration right now because they want to increase the amount of solar that's on the grid pretty dramatically over the next 10 years, but you can't really do that if you're dependent on this country that is responsible for 80% of all the solar panel production if you care about the fact that they're using slave labor to do it. So they're kind of relaxing their moral guidelines in order to increase the amount of solar.
China has dominated the solar industry through heavy subsidies. And with that latest Inflation Reduction Act that President Biden just signed into law, the U.S. is now beginning to subsidize renewable energy. But without yet having the capacity to produce those solar panels and other renewable energy parts here at home. And it will take a very long time before the U.S. can match China in this production and revive a solar industry that has been decimated over the past 20 years. Reporting in Washington, D.C., Melina Weiskup, NTD News.
Minority Leader Kevin McCarthy and a group of House Republicans have a plan to combat the CCP's nefarious activities if they take the majority in November. One congressman involved is Representative Randy Weber of Texas. Here's a look. Congressman Randy Weber, thank you so much for joining us on the Capitol Report.
Glad to be here. Thanks for having us, Steve.
Congressman, you were part of a group of members of Congress that announced a new act to close in on Chinese espionage. If you could tell us what prompted this bill.
Well, I mean, it doesn't take a rocket science to figure it out that the Chinese are not our friends. There's so much history here, and as you know, we're aimed at taking back the House, the Republicans are, and God willing, we'll get the Senate too, and then we'll hold this administration accountable. China has been stealing stuff from us for so long. As you may or may not know, Kevin McCarthy, the minority leader right now, he'll be, of course, the next speaker. He went to Nancy Pelosi a couple of years ago and said, look, we ought to form a China task force, bipartisan, both, Democrats and Republicans. And we ought to get to the bottom of some of this stuff. As you know, Trump closed down the Chinese consulate here in Houston, Chinese consulate here in Houston. I live in Friendswood, South Houston, about 20 miles. And so China has been bad actors for a long time. Pelosi agreed that we would form they would form a China task force. And then as it got time to actually put it together, she backed out. They're bad actors. They kill Uyghurs. They are such terrible human rights violators. And so it's about time. And of course, Biden will do nothing toward trying to rein them in. But that's kind of the background. We know that China's been a real bad actor for a long time. As you know, pandemic really highlighted that. Supply chains are bad. We don't need China manufacturing our medicine, manufacturing our chips, and sending fentanyl across the southern border through the Mexican drug cartel.
One of the things you also touched upon was China's human rights abuses. China, goes to great lengths to try to keep their image glossy on the world stage. Do you think that this will be something that, the Republicans will be talking about more if they were to take power? Well,
absolutely. And let's take the if out of that sentence. When we are to take power, absolutely we are. And you already know this, that the Democrats put, I forget the exact total, $240 billion in the last bill to buy solar panels and windmills from, of all places, China. And so we'll be talking about it more and more. We want the American people, the American public to know how bad the Democrats' policy has been. Of course, inflation, you go all down the kinds of things. And I'm sure you know the Chinese provide the fentanyl for most of the drugs that's coming from our southern border. And I'm sure you know that, and here's an astounding statistic. 100,000 Americans are dying each year, ages 18 to 45, from fentanyl. That's 300 Americans a day. Now, Steve, do this math. Now, that's an entire airliner, more than an entire airliner. We have a major airplane going down in America every single day, killing 300 people. And the Democrats will do nothing about the southern border. China is coming in and attacking us to our southern border. The American people need to know that. It's obvious. It's real. They are now in bed with the Mexican drug cartel. And so, do you remember Juan Chapo, who was the Mexican heroin king? They finally caught him. China is the heroin and the drug war, and even their best ally, our worst nightmare, our worst enemy, sending fentanyl in to kill our people from 1845. They've got to be reined in. All of this has to stop, and the border will be part of that legislation, by the way.
Congressman Randy Weber, thank you so much.
Yeah, thank you, Steve.
Dr. Anthony Fauci, the White House medical advisor, defending the FDA's decision to authorize COVID-19 vaccine boosters without doing any clinical trials on human beings. Here's what he said on Canadian State Broadcasting Network, CBC News, earlier this week.
It hasn't been proven in a clinical trial because we don't have time to do a clinical trial, because we need to get the vaccine out now, because we have such a situation throughout the world, and certainly in the United States. We're having 400 deaths per day.
The FDA on August 31st authorized updated boosters by Pfizer and Moderna. The CDC recommends the boosters to all Americans aged 12 and above. Pfizer and Moderna presented data from testing done on mice. There is no human data available. In a briefing this week, the White House said COVID-19 vaccinations will likely become an annual occurrence, just like flu shots. Infectious disease expert Dr. Jim Meehan joins us to weigh in. Dr. Dr. Jim Meehan, thank you so much for joining us on the Capitol Report.
It's great to be with you.
Doctor, the White House has just recently signaled that the vaccine will turn into, or the booster will turn into an annual shot. Why are we seeing this transition away from the boost, really?
Well, yeah, great question. They signaled it by buying 170 million doses of an experimental vaccine that's only been tested on 8 mice. This is not science and medicine. This is not the scientific process. This, in my opinion, this is corporatocracy. This is the FDA being captured by the pharmaceutical industry. It's no surprise to me that they're going to turn this into a revenue stream that's a once-a-year booster. By the way, once a year isn't going to help anybody except the pharmaceutical company. These vaccines are, they last about 3 months, 3 to 4 months at best with antibodies only. And those antibodies seem to be enhancing the coronavirus disease. SARS-CoV-2 in heavily vaccinated individuals is showing enhancement. They're not protected from hospitalization or death. And we're now to the point where we're going to experiment further on the American population with a bivalent vaccine that's only been tested in 8 mice and only tested to see if it produced more antibodies. Antibody elevation does not equate to protection. It has not shown to prevent hospitalizations or death. And I just beg our public health agencies to reclaim science, to start the scientific method again and stop serving the pharmaceutical interests.
Doctor, to your point, Dr. Fauci has just come out and said that we don't have time to run clinical trials for updated boosters.
Dr. Fauci has been wrong on every point of the vaccine. Of course, he flips and flops, tries to get back on the right side of the equation, but he's wrong on this. We can't afford not to take the time to conduct the safety science. We can't afford to do that. I'm looking at the data every day. I've read over 11,000 of the vaccine adverse event reporting system reports of death. There's 30,000 deaths, more than 30,000 deaths reported in the one database that was set up by Congress to monitor safety signals of vaccines. 30,000 people have died, and that's in a database that is probably underreporting by a factor of 41. So it's possible that this vaccine has led to the deaths of 1.2 million Americans. I think that number is probably underestimated, quite honestly. I think there are very few Americans that don't have 1 degree of separation from a family whose loved one was vaccinated and died. I know I am. I've just lost 3 days ago a surgical technician that worked with me for many years, had just turned 40. 2 days after getting a booster, he died, found unresponsive in his bed. I'm still struggling with the loss of that good friend. Why are we still giving the pharmaceutical companies an absolute free pass, no liability, they have no liability when these vaccines are killing 30,000 or 1.2 million vaccine recipients? There's still no one to hold accountable. And I think that's all of these things mark a tragedy, a historic tragedy in medicine that will get on the right side of this history, because historically, this is the biggest mistake we've ever made in the history of medicine, science, the scientific method, and turning over public health to the pharmaceutical industry.
Doctor, we're very sorry to hear about the loss of a personal friend that you have. We are hearing more and more about SADS, this sudden adult death syndrome. You're reading about it. You're seeing young, healthy athletes just collapsing and dying. Is this because we're more focused on it and it was something that would always happen, or is this a real concern?
No, this is a real concern. This is not something that we're just now noticing. This is people that have been vaccinated, whose hearts are inflamed, the youngest, strongest members of our population that are being compelled because of their athletic organization is forcing them to get a vaccination. These deaths on the soccer field, or as Julie Chen, a national news reporter here in Tulsa, had a TIA. She had a stroke live on the air just 2 weeks ago. You know, how all of these personalities, previously healthy individuals, are having these sudden deaths, sudden strokes. Their vaccine injuries Steve, and we've got to stop pretending that it's anything other than what we failed to do. We did not do we did not apply the scientific method. We didn't do adequate safety testing. We warp speeded this thing. We checked it on 8 mice. We're using low-level observational studies funded by Pfizer and Moderna and conflicted interests. And we're getting pseudoscience to support a false narrative for a vaccine that has failed. And we're just continuing to push it in more and more arms. I don't know what's driving that. I really don't know what level of incompetence, ignorance, or perhaps malevolence is driving it. But it's got to stop, and people need to be told the truth. And I appreciate you giving me the opportunity to share my truth as I see it, as someone that took an oath to do no harm, took an oath as a member of the United States Army to defend the citizens of this country from enemies, both foreign and domestic. And I think we've got some domestic enemies that are perpetrating harmful medical interventions on the population.
Dr. Jim Meehan, really appreciate your perspective, and thank you for joining us.
Thank you, Steve. Keep up the great work.